to it.
Absolutely. Yeah. Thank you so much for having me. This has been really great and informative. And I feel like we intended for all of this stuff to connect really well together, but it's even more so than I could have imagined. So yeah. All right. Let me go ahead and share my screen. All right. So, obviously, with everything that's been going on in the last year, we've talked a lot about immune health and what does that mean for athletes. And this topic is something that I've spent a lot of time on in the Pirates organization, and then also at the high school level where I teach a sports nutrition class. And so the three things that we really focused on, the gut health, brain health, and sleep. And so just hearing, Wendy and Dr. Mira and them, how, the mental health component of it all, it just makes so much sense. So don't hate your guts. That's obviously a little pun there. We'll skip objectives, but definition of terms. I just kind of wanted to go over some of this terminology a little bit because it can get a little bit tricky sometimes. So just a little bit. Immune system, it's a network of cells, tissues, and organs that work together to defend the body against attacks by foreign invaders. And we'll talk a little bit more about that. Your gut is your intestines. And so I think a lot of times when people hear gut health, they think it's maybe your stomach, but it's your intestines, and it's also your stomach. So it starts at the very start of your small intestine, or starts at your small intestine and carries your way through the very end of your large intestine. And then also we kind of hear interchangeably microbiome and microbiota. And that's just the totality of microorganisms, bacteria, viruses, protozoa, fungi, and their collective genetic material that is present in the gastrointestinal tract. And then probiotics, we'll talk a little bit about that, but I know Allie's going to hit on that pretty good. Live microorganisms that are intended to have health benefits when consumed or applied by the body or to the body. So what is the gut? Let's talk about that. It is your intestines. So it begins at the very start of your small intestines, like I said before. It's also referred to as the GI tract. So the whole GI tract in general includes your mouth, esophagus, and stomach. And so just to put into perspective, we have 28 feet of intestines. That is huge. It is a large organ, all cramped up in one little space in our abdomen, right? So just kind of keep that in mind. So what is in our gut? So the picture on the right here, that's basically the inside lining of your intestines. And we all have seen, like from biology class and that sort of thing, the little villi that, wiggle back and forth and helps absorb nutrients. And one of the things in nutrition, we like to say kind of looks like shag carpet, but now, well, this generation doesn't know what shag carpet is. So we have to kind of find a different way to define it. But the inside of your small intestines is what absorbs all your nutrients. And it's also super important because there are over 100 trillion microorganisms located in and on your body, with most of those being housed in your gut. So in that 28 feet of intestines, you're going to have most of those 100 trillion microorganisms. There are over 1,000 different bacterial species in your gut. And then also we know that the gut microbiota will promote digestion and absorption of foods and forms short chain fatty acids, which we'll talk about in a little bit as well. So let's talk a little bit about the immune system. So what is it exactly? Like I said, it's a network of cells, tissues, and organs that work together to defend the body against attacks by foreign invaders. So one way that I kind of put this into perspective, so a foreign invader can be bacteria, parasites, fungi, other things that can cause infections. And so imagine, this is the analogy I always give when I teach this in class. If your immune system is on point, you've been sleeping well, you're eating well, you're taking care of yourself and doing all the things right, your immune system's like, yeah, I got this. Someone, and this is pre-COVID, pre-masks, obviously. Someone walks down the hall, they sneeze, there are a few people ahead of you, they sneeze, and your immune system's like, I got this, we're good, we're in a good spot. Now, if your immune system is not working properly, it could be a situation where you haven't been sleeping well, you haven't eaten very well, you're skipping meals, you're falling asleep in class, and your immune system's like, man, I'm struggling. This is hard. So now that same person that sneezed when your immune system was on point, they sneeze again, and then suddenly you don't have the immune system that can say, you know what, I got this. It's like, you know what, I don't know what to do with this. This is a bacteria. This could be a virus. I am exhausted. So something's going to happen. So that's kind of a way to think of your immune system. So when it's working, it identifies and attacks different threats and protects you from those threats, whether it's viruses, bacteria, parasites. And your immune system can distinguish between healthy tissue and the bad guys. And one of the things, and I'm sure we've heard a lot of this, especially in the last year, of how much of your immune system is actually located in your gut. And it's about 70% of your total immune system is in your intestines. That is incredible. Just to think. So, and then here's just a picture of your other immune system organs. You have lymph nodes, your respiratory system, skin, obviously, the main, protective barrier. And so just thinking though, that 70% of your immune system actually lives in your intestines. And so, anytime you're eating, there's trauma, right? And whether it's good food, bad food, there has to be something that is done to take care of all that food, and all that goes through your intestinal tract. So the human body is incredible. So just working together, we have good bacteria and bad bacteria, right? That we try to get rid of the bad stuff, keep the good stuff. So you are the host to all the bacteria that's in your gut. So yes, you host it, whether it is good or bad, it lives in you and you get to house it. So together, you and your gut microbiota will help sustain and build your immune system to keep you healthy. So because you're hosting all these visitors inside your immune system, inside your intestines, it is your job to take care of them. So if you have friends over and you're hosting people at your house, you're not just going to be like, you know what? Well, or you might, drinks are in the fridge, go get yourself some food. No, you're going to be a good host. You're going to provide them with all the things they need. It's the same with you being the host to the good bacteria in your system. And so how do you as the host and that bacteria actually communicate together? Because there has to be something that links the two together. And this is where it gets super interesting. And this is where I get kind of geeked out on this kind of stuff. And where, Wendy's talk and Dr. Mira's talk really kind of comes together with this. So let's see if there we go. That TV was driving me nuts. Okay. So it's called the gut brain, right? And so the connection between our gut and our brain occurs via the central nervous system. And so it's so crazy, again, to think that what's happening in our gut, that information will travel up the central nervous system, up the spinal cord into the brain and help relay different messages. So a little bit more, digging a little deeper with the gut brain. So let's talk a little bit about serotonin. So serotonin is a key neurotransmitter in the brain. Over 90% of serotonin is synthesized in your gut. And so what serotonin does is it affects mood, social behavior, appetite, digestion, sleep, and memory. Now, as an athlete, all those things are probably pretty important. And we know they're important just in general as well. So serotonin related health problems have been found in the elderly, such as things with depression, sleep disorders, anxiety. And that has been linked to decreased diversity and stability in the gut microbiota, which basically that means how many different strains your gut has. So the less diverse our gut bacteria is, the higher the risk of having different sorts of health problems. And those are the things that they're finding in the elderly. Serotonin also helps with gut motility, which is important in patients with IBD and other digestive disorders. And not to mention, just as athletes, gut motility is important. There's a lot of traveling, so sometimes we're not hydrating as well. There's, more instances of constipation, diarrhea, that sort of thing. So having a good, having good gut motility is incredibly important. Serotonin is synthesized from tryptophan, so increasing evidence on the importance of serotonin production in sleep. Again, sleep, brain, gut, really important. And then tryptophan is a precursor to melatonin, so it just keeps getting better. And we know melatonin, a lot of our athletes will take some of that before bed if they're having sleep problems. So, is it the melatonin, or could we be doing a better job taking care of our gut? What are some things we could do? And then talking a little bit about dopamine and the gut brain. So about 50% of dopamine is synthesized in the gut. And what dopamine does is it helps with memory, decision making, attention, motivation, and reward. Again, how important these things are in our profession, in sports in general. Physical activity stimulates the release of dopamine. Well, we know we have athletes that are going to be physically active, so that's one thing that does help. There has been some research that has linked decreased dopamine levels to Parkinson's disease and maybe Alzheimer's, among other things. So there's just so many new and interesting things coming out with just the gut health in general, but with the serotonin, dopamine, and all those things. It's really, really exciting. So let's talk about short chain fatty acids, like I mentioned previously. So short chain fatty acids are fiber, basically, and they're also known as prebiotics. So short chain fatty acids are the food that the microbiota needs to thrive. And so when we have athletes that take their probiotics, they might ask a question about, they'll ask like, are beans good for me? Or, we'll talk about fruits and vegetables and that sort of thing. And my thing is always feed the good guys, right? So get your high fiber food so you can feed the good guys. We want to feed the good bacteria that's already in our gut. So that's one way that they can easily remember: high fiber food, feed the good guys. Short chain fatty acids help keep the lining of your large intestine healthy and intact. And then they are also the main source of nutrition for your colon, like I just mentioned. Decreased short chain fatty acids are linked to inflammatory diseases, type 2 diabetes, obesity, heart disease, which kind of makes sense. So if we're not eating a lot of whole grains, fruits, vegetables, high fiber foods, we're probably eating things that aren't as nutritious for us. And so that could end up leading to some other health issues. And then just some high fiber foods right there that you can see. All right, so here we go. What causes our immune system to weaken? And this is something where you kind of go down this list and you think about your athletes and you're like, dang, they got them all. So stress, yep. Sleep deprivation, probably. Poor diet, sometimes, yes. Aging, we are all aging. High intensity and long duration exercise, yep. Travel, yep. Environmental factors, yep. Other psychological stressors. The list is so relevant to our population that we work with, whether it's baseball, basketball, football, high school sports, college sports, does not matter. All these things that have a tendency to weaken the immune system are so near and dear to our population. And I think it's important that we really recognize some of these things. Chronic use of medications, including NSAIDs or Tums, other antacids, prescription medications, antibiotics, anti-anxiety drugs. And one thing to kind of think of, pro is for, right? Biotics is life, for life. Anti is against. So anytime you take an anti-anxiety, antibiotic, antacid, that's all against. So the pro is for. So all these things that if we constantly take them, we're really doing a number on our gut health. So then, athletic performance stressors, I basically just repeated the stuff that we had in the previous, because, just what things affect our immune system negatively, and then what are some athletic performance stressors. Wow, it's all kind of the same stuff. One thing that I want to add is during the physical activity, there is a decreased blood flow to your splanchnic organs, which are basically your organs in your abdominal cavity. And I remember this when I was in the collegiate world. A lot of your freshman distance athletes would come in and have serious, abdominal cramping and stomach pains after anything they ate. And, you add moving to a new city, being away from parents for the first time, increase in their daily mileage or weekly mileage, lifting weights for the first time, all those things. And then obviously how much they run, there's decreased blood flow to the abdomen. And so a lot of those things were causing some of those GI issues. And it's the same for our athletes. When they're exercising, if they just ate a fast food meal and then showed up to the workday or to practice or whatever, and there's less blood flow to the gut, it could be a big disaster. Okay, so leaky gut, talked about this a little bit. So what is it? It is literally when the lining of your intestines has holes. So you can see the picture on the left. That is what normal intestinal lining looks like. You can see the pathogens and all that stuff they're trying to get through, and the intestines, all those little shag carpet villi. Those guys are like, nah, we got this. And so that's your immune system right there, really acting in accordance with protection and taking care of your entire immune system. Then you have the picture on the right. And so that is what happens when we're not taking leaky gut. So this is all those immune system stressors, all those athletic performance stressors, those kind of catch up to us. And those little junctions, those three little lines that you can see that are holding those villi together, they're not able to do that anymore. And they're like, phew, I can't do this. So now you have those pathogens that are passing through and literally getting into your bloodstream, literally getting into your bloodstream. So if you think about it, where does our blood flow? Everywhere. So now we think about it, okay, so we have all these immune system stressors. I have probably not eating very well, not taking good care of myself. I'm probably got some leaky gut going on, and I'm having some symptoms of depression. I mean, it's just the whole gut brain is so incredible and so amazing. And so that's what's happening. Like literally we have pathogens getting into our bloodstream and really just creating a fog and a blur and preventing our athletes from not only being able to perform at their most optimal level, but just on a day-to-day feeling their absolute best. So then we'll talk about probiotics. And again, I know Allie's going to talk a lot about this, but so what can we do? How do we get rid of leaky gut, right? So what we want to do is inhibit the growth of the harmful bacteria. And that's what probiotics do. What they do is they'll compete for nutrients in your intestines. And so one of the things that I always have to kind of teach athletes and the players is okay, off season is probably the best time for you to start a probiotic regimen to get your intestines used to what this feels like. Because yes, if you take some probiotics, if you drink a kombucha and you start getting the bubble guts, that's those good guys getting in there and being like, man, I got a lot of work to do. All right, let's get to it. And so there could be some issues with unwanted bathroom trips and that sort of thing. So you have to be cautioned with that. One thing that I also will tell athletes to do is make sure you take your probiotic at night. That way those good bacteria can really start stepping it up and take care of business in the night. And then you'll have all morning to kind of get some of that stuff cleansed out of the system. They also increase the acidity of the surrounding environment by producing those short chain fatty acids. So with those short chain fatty acids and the good bacteria, they keep your gut at the perfect acidity level for all of that to thrive. So it's like a built-in superhero. And the microorganisms must be alive. So, yogurt obviously is refrigerated. Kombucha is refrigerated. One of the things, my oldest, he likes to drink kombucha, and he knows he can't drink a kombucha when he's eating his hot meal because we don't want to kill the good guys because they're alive when they're, refrigerated. And then when they get into the system and get to work. But if you take your probiotic and you drink some coffee, probably not really doing a whole lot of good. So what the probiotics do, they interact with that epithelial layer and to tighten those junctions, making it more difficult for the harmful bacteria to pass through, which will reduce inflammation in the gut. And so we're going back now, taking a look at the picture on the right, and we're taking some probiotics, making sure we're getting probiotic rich foods. And we're, looking more like the picture on the left. And what it does is it just makes it more difficult for the bad bacteria to get into your bloodstream and just negatively affect your immune system. So, all right. So probiotics and athletic performance. So interesting. So to date, there's no studies that indicate probiotics have an ergogenic effect on athletic performance. Like, I'm on a probiotic regimen. Now I throw 3 miles an hour faster. No, it's not like that. It's the secondary benefits of the probiotics that's helpful in maintaining the good general health, especially for those who are under excessive stress from repetitive bouts of extreme and intense exercise. And so this is where, you know, taking a probiotic during the course of a competitive season becomes incredibly important. And I think, you know, for our guys, we have different, and I know Adam and Terrence talked about it, we have different protocols. So we have a general health protocol, which obviously depends on each individual athlete, but probiotics is in that. It's a multivitamin omega-3 and a probiotic that we highlight in our general health supplement protocol, just because it's one of those things that we really want to make sure that we're highlighting and really focusing on during the course of a really, really long season. I mean, we've all seen it, no matter if it's a high school athlete or a professional athlete, you know, day one looks a lot different than day 118 or wherever we are. And a lot of those things are not controllable. Like, you can't control the rain delay. You can't control the, the coach's intensity of the exercise, and you can't control how long practice is going to be. You can't control, you know, so many factors, but some of the things you can control are incredibly important. And, you know, taking care of your gut is one of those things. And so one thing and this is just always makes me laugh. So the future in doping, right? Which is this is totally not true. But so in cycling, the story was done in cycling, that there was a poop transplant. So if anybody is, wanting to get on the frontier, and basically the reason for this story, and this is what's super interesting with athletes anyways, is as athletes, they have a more diverse and wider variety of gut bacteria, and that is so incredibly important. And so this story was really interesting. It was a woman who had cancer, and she was coming back from treatment and stuff, and she wanted to get in better health and stuff, and she did some research and realized that yes, fecal transplants, you know, to improve her gut microbiota was really helpful. So super interesting. It's just one of those like, ha ha ha, ew, I don't think so kind of moments. Exercise in the gut. Research shows that exercise increases gut function by reducing the time that stool is in your system. So if you have issues with constipation, the stool is sitting in your intestines for a long time, and that can create some harmful bacteria and do some damage. And then, like I just mentioned, athletes have a more diverse set of good bacteria in their gut, and higher concentrations of bacteria that defend against obesity, chronic inflammation, help with oxygen uptake, and improve barrier function of the intestines. And then one thing to just keep in mind, exercising when dehydrated can negatively affect your gut health. Again, it's the decreased blood flow to the splanchnic organs. It's, you're just not performing as well anyway, and it just can have a real negative effect on your gut. All right, that's what I got. So there's your good guys and your bad guys fighting each other in your intestines. So thank you.
Awesome. So that was an interesting article from the New York Post. I'll say that.
I know, it's so gross.
Listen, great stuff right there. I put down a bunch of questions. I know there'll be some for you. If you can hold tight for another 25 minutes, we'll have you back on with Allie. And I'll introduce our next speaker, and then we'll go do a little panel, and then we'll finish up for the day.